Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, on the show today we are going to be exploring innovations for sustainable health financing through universal health coverage. And this is exactly the theme of a conversation we had at the Startup South conference that held in Enugu on 22nd October 2021. Talk Health Nigeria partnered with the organizer Startup South because we believe that health conversations should not be treated in isolation. It's a tech event. It was a tech event, made up of technology experts, ICT, and innovators, especially from the southeast and south parts of the country. And we had a very robust conversation with David Onyinyechi Ago, who is an economist and also a pharmacist in Kemjika, Uwezoke, from the University of Nigeria, Enugu campus. So the show today is just all about that. We're going to take you to that conversation we had during the conference. But we're going to take a break, and when we return, we take you there. Don't forget to follow us on our social media handles displayed on your screen. And the program will also be on our YouTube channel, Talk Health Nigeria TV, which you can watch as many times as possible after this show. You might be wondering why this health channel in a tech event. COVID-19 pandemic has shown us that health is everything. It's not just about the well-being, but it's also a security issue, it's an economic issue, it's an education issue. And sustainable financing for our healthcare became more prominent. All the gaps in our healthcare system became more evident when there was lockdown and when we were struggling to respond to the pandemic. So this panel today seeks to explore innovations that we could bring to getting more funding for health in order to achieve universal health coverage. And universal health coverage simply talks about being able to afford quality health care without financial difficulty. And what that means is you don't need to sell any of your property, you don't need to borrow money, you don't need to go to beg for money to treat any kind of health condition that we have. That's not the current situation, but that's where we are working towards to get to. So, we're going to have this conversation over the next 20 minutes. It's been argued that in health financing, we want more money for health, but we have enough money to give to health. So I'll be starting with Dr. David Onyinyechi Ago, an economist. So what's your take when it comes to the revenue side of the economy vis-a-vis the quest to having more money for health? What is the current situation and how do we optimize to making this possible?
First, we are worrying ourselves about the level of revenue for health. I think it's from the government angle that you are asking, or is it from the individuals?
From the aspect of the government.
From the aspect of the government, I will say we actually don't have sufficient revenue for health. And not only that we don't have sufficient, even the little we have, we are not efficiently utilizing them. And what does that mean? Some of us must have heard of the issue of 15% proportion to health sector. And you would have asked yourself, what proportion do our governments, I'm talking of all tiers of government, what proportion do our governments allocate to the health sector? If you plot a chart, let me just use the current year. If you plot a chart of all the sectors in Nigerian economy and look at federal government budget 2021 or even the 2022 approved proposed budget, and plot a chart of how much goes in or how much is expected to go in to all the sectors, you will find out that health sector comes to somewhere around between 12th and 15th position. And why is this so? The first thing I will talk about here is the issue of prioritization. Until COVID made it impossible for all the politicians to quickly jet out to India, UK, US for medical tourism, most of our politicians do not see the need to invest money in the health sector. Not that the little we have cannot be used, but because we don't see the need. And it is that issue of prioritization that remains a burning matter. We are not saying put in 1 billion naira when you are earning 800 million. But if you are earning 800 million, let's take an optimal proportion of that 800 million and put to the health sector and find out what it can give us. But even the little we are getting, because we have not seen the need, 4, 5, 6% of the entire budget goes to the health sector. Whereas we are part of the people that said 15% of our budget should be allocated to the health sector. And in several fora, I have had a lot of people argue, oh, health sector is in the concurrent list. Why should we always focus on the federal government budget and not the state? But go and check your state budget and find out whether it is any better. And it is at that point I want to stop for now.
Okay, thank you very much. We're talking about money here, and the earlier panels, we're talking about businesses, startups, optimization, ideas, innovations, and all that. So, is there a nexus? Can we bring money from creative arts into health? Let me now come to you, Pharmacist Uwezoke. The pharmaceutical industry in Nigeria is the largest in West Africa, and more than 100 pharmaceutical companies operate in the country. But even at that, over 80% of them do more of importation than production. And over 90% of our health commodities are imported, that we use. And one may argue, because the government policymakers, a lot of them view health from the aspect of humanitarian, the aspect of charity, the aspect of doing good, and not the business aspect of it. So how can we tap from the pharmaceutical sector and optimize resources and revenue that could be used to finance the health system?
Okay, thank you. Good afternoon, everybody. I'm excited to be here. I take it as a real privilege. I'm a pharmacist and a businesswoman, so that I'd approach this from a numbers perspective. First of all, 30% of the cost of health in Nigeria is medicine's cost. So I'd like to address medicine's cost. And how is it that you want the pharmaceutical industry to bring out revenue to fund health? I think the first thing we should be talking about is to revive and improve and optimize our pharmaceutical industry. Pharmaceutical manufacturing in Nigeria is hardly happening. That 100 and something companies you listed, yes, you're right, 80% of them are importing. They are rebranding, they are repackaging. They are not manufacturing. And what is affecting the pharmaceutical manufacturing is the same thing affecting all other sorts of manufacturing. So there are two approaches, please, so that we don't just bemoan our fate. I'd like us to move forward. What can we do? First of all is government intervention, and then secondly is private sector intervention. From the government, we need subsidies, we need tax breaks, we need SMEs to be encouraged. Pharmaceutical manufacturing in Nigeria was primarily about multinationals for many years, before the smaller companies that are totally indigenous began, the likes of Juhel, the likes of Emzor. But we are still not having the micro and small enterprises in pharmaceutical manufacturing, because of so many problems that build a barrier to entry. If we can get rid of those gridlocks, funding, tax breaks, not even just funding, because if people know that something is a veritable enterprise, they'll find the cash for it. But you must build a sustainable environment so that when people bring foreign partners, bring funding from elsewhere, they can actually do business. So we need those subsidies, those tax breaks. We need infrastructure. There's nothing I can do if I spend all my money on diesel every day. I won't make any money. My break-even will just keep becoming a mirage. After that, then we can talk about how to modulate regulation. Thankfully, NAFDAC has been alive to those responsibilities and has been adaptable since COVID last year. We've heard about a lot of new things, reduction in registration fees, supposed reduction in bureaucracy. If those things can materialize, then we can have smaller players, plenty small players. I became an unofficial small player last year when I started my own pilot production of sanitizers. And why not so? I'm a pharmacist. People were doing it inside the market, so why not? So people like me should be encouraged, even if it's one or two products that you have, okay, and the regulations simplified. Then before I drop, I'd like to touch on what the private people can do and what people like you in Startup South, what the tech people can do.
Okay, we'll come to that, but okay, there's a question I want to quickly ask. As part of what you touched on what the tech people can do.
Okay.
Counterfeiting of drugs is a huge problem, counterfeit, fake drugs.
Okay.
And it's been argued that blockchain technology and all that. In fact, I was at an innovation event like 4 years ago, where the winner was in Denmark. The winner is a Nigerian, and he has this idea on the use of blockchain technology to halt counterfeiting of drugs.
Oh, wow.
Yes, and there's also someone else, an Indian that worked with him. Very fantastic stuff with over 1,000 persons. So it's something that the folks here, because they've not quite invested in that idea, could begin to think about. So in that area and in other areas, where does technology come in terms of optimizing you talked about the small scale enterprises, and where may they also come in terms of supporting the bigger enterprises?
Okay, so there's a lot of things that tech can do in health, and it's just a wonder that a lot is not being done already. Health has been one of the most ancient, some of the most dinosauric industries, those industries that have refused to evolve, that have refused to embrace tech. I don't know why it is that health is not interested in tech, or tech is not interested in health. And it's a wonder, because aside from food, I don't know what else is as essential as medicines. I don't know what else will always sell like medicines, right after food. So why tech people are not doing a lot yet? I've met a young man, I'm mentoring a group actually, a group of medical students right now, who set up a tech company that makes registries for big hospitals, patients who have diabetes, patients who have cancer, and so on and so forth. I was recently speaking with another group of young people who want to form a company that keeps data for research. chest x-rays from here, partners with hospitals to mop up data and keep in a big bank. So first of all, we must be talking about big data. If, for example, we have people who are investing in finding out what it is exactly that Nigerians need, what are they consuming the most, where is it being needed, who has it? All of them had to happen in a knee-jerk fashion since last year. I'm on all sorts of WhatsApp groups so people can call for drugs from all over. Someone should have started thinking about that sort of app. Then we also have the crowdfunding option. We've been doing it with PiggyVest, doing it with Farm Crowdy, taking penny money from small investors, pulling it together to give farmers. Why aren't we doing it with R&D? Why aren't we doing it with pharmaceutical manufacturing? Or do we think that these things don't bring in returns? There should be something that picks money from investors and pulls it together and works with local manufacturers in health to bring in funds, much needed funds, at lower rates for manufacturers. Then finally, we should have innovation like what you're talking about. Starting from the scratch card, it was someone that started it. Just the scratching that made you send to a number that authenticated your drug. We should have moved further from there. Whether it is barcode scanning and so on and so forth. We should have a lot of things that if a group of young creatives come out and say, we have this, companies can now buy the technology to secure their drugs. Because if they don't make money, and the money goes to counterfeiters, then the industry falls to the ground. So there's a lot of things that tech can do in health, actually.
Thank you very much. A lot of ideas being shared there, and it's been growing in recent past. There's a lot of telemedicine and apps where you can be here, do some diagnosis, and provide services to certain persons elsewhere. But of course, like you say, we need much more, especially in the financing and production setting. Coming back to you, Dr. Ago, you've done a lot of support to, you are not a government worker, but I keep asking you about government because apart from being a private sector person, you provided a lot of consultancy services to internal revenue boards and health financing mechanisms to both private and government clients. So what is that, do you think, in terms of revenue generation to support universal health coverage? Universal health coverage is health financing that covers everybody. Everybody has health insurance cover. So right now we have the basic healthcare provision fund, which is just 1% of consolidated revenue fund of the federal government. In 2022, budget is about 55 billion. And every state is setting up their health insurance agency just to take certain percentage of that basic healthcare fund. And they complain that they don't have money to give their own funds and as well as mobilize funds to ensure that everybody is covered. So what ideas do you think that those in the tech space might be able to look at in terms of providing solutions to state government to get revenue and fund universal health coverage?
All right. This like asking me how can tech people come in to the entire architecture of government revenue. I don't know how many of us here have ever maybe driving through any street or any major road, whether in Enugu, Oka, or anywhere in the southeast, and you see some young girls or young boys doing some paper like this, and they are specifically waving at keke drivers or bus drivers to pick daily tickets from them. I don't know how many of us have ever seen that. It happens almost in every city in the southeast, and it's on daily basis. Now, that is our own method of revenue collection. And I keep saying it, I have said it 1,001 times, that it will only take an angel to stand under the hot sun like that, waving paper from morning till evening, and then come back and tell you, I got 20,000 naira that day, and it is actually 20,000 naira that he or she got. We have a system of revenue generation that creates room for leakages. And before it will move from that girl or that boy that stood on the road to the person that hired him, some money must have dropped. By the time it moves from the person that hired him or her to the government agent, some money must have dropped. And then by the time it gets to the government account, you must be sure that at least 50% of it had gone. That is our own method of revenue generation. A revenue generation system that creates room for somebody to eat from the system, not official eating, unofficial. So how can you that are seated here come into that system? Have we ever thought that the government will not be happy to embrace a system where you have developed an app or a USSD code that the keke person is supposed to just send a USSD code, and automatically, let's say from his airtime, automatically some money goes off his airtime and hits the government account. Maybe that's a technology between the telecom companies and then the financial institution handling government money. You can be the bridge that is needed to make that happen. And it is not just for health financing. All forms of, all areas of government revenue is affected. It's not just for healthcare system alone. But if you have ever read anything like a budget implementation report, whether it is at the federal government level or at state level, you will always hear it comes very boldly. We had a shortage of 34% or 35% in projected revenue, and as a result, implementation of our capital budget, not usually recurrent, implementation of our capital budget falls below expected. It comes boldly almost in every quarter budget implementation report. And we have a means to make that projected revenue to even be lower than actual revenue, because virtually all the states, their budgeted internal revenue is much lower than their capacity to generate. But because we have loopholes that have not been thought of, I can cause this man standing on the sun to get out of the sun, and there is a technology with which the keke man can pay his daily ticket, and the government receives the full money while I get a certain percentage of that. So that's what I'm leaving with all of you here seated. Can someone go back home and think there are ample opportunities for you to come in, and there are people willing to listen to you as long as you have solution? Thank you.
That's really lovely. Thank you very much. We wish to continue, but we really have to end it here. But before I formally call it a close, in health insurance, there is the formal and the informal sectors. And most of what we witnessed since 2005, when the National Health Insurance Scheme was set up, was the formal sector, where mainly federal government civil servants were enrolled. In the last couple of years, virtually all the states have been able to set up state health insurance agency. Why? Because in 2004, the National Health Act in Section 11 made a provision for the Basic Healthcare Provision Fund that gets 1% of consolidated revenue fund of the federal government, money from donations, 25% counterpart funding from states, and as well as other resources, and say 50% of those entire resources should go into providing health insurance, but it's grossly inadequate. So what about the informal sector? What innovations can we come up with to have a session of keke riders, Okada riders, artisans, farmers association, cassava farmers association of Nigeria, all these various groups to be able to pool money together and buy health insurance for themselves? Because the health insurance is to create a large pool of funds where everybody will be able to get support. If you don't have that large pool, you will only be providing insurance for malaria and flus. You will not be able to provide for kidney failure, heart disease, cancer, and all of that, like we currently have. So think about innovations that you could come up with that get more persons, especially in the informal sector, to be able to finance and get themselves health insurance coverage. Dr. David Ago, I really want to thank you for being a part of this. And also, pharmacist, I know there's a lot to say, but I really have to end this. Pharmacist Nkemjika Uwezoke from University of Nigeria. All right, I hope you enjoyed the conversation we had at that event, the Startup South 6 conference that held in Enugu, Southeast Nigeria. So that's the much we can take today. But do know that health insurance for every Nigerian, mandatory health insurance, is what we need to achieve universal health coverage and make quality healthcare much more accessible to everybody. So more money for government could mean more money for health. Play your part, let's make it happen. Let's see you same station, same time next week. My name is Dr. Lars Eze. Bye for now.